Hi, I'm Dr. Fong. In this video, we will show you how to treat a concussion the right way. The first thing to do is to seek professional medical care, whether that's calling your family doctor, going to urgent care, or maybe even the emergency room. When you suffer a concussion, you want to know right away if there's any physical damage to your brain. Don't delay on this step, because there could be internal bleeding or structural damage that could put your life at risk. After this first step of seeking medical care, you should reach out to a concussion specialist for concussion treatment. They could be called a concussion specialist or a sports medicine doctor, or they may say they specialize in traumatic brain injuries or TBIs. It is crucial to get concussion treatment within the first 72 hours of your accident because this is the best time to make sure your brain recovers quickly and correctly. When choosing a clinic, their concussion treatment should include therapy specific to your injury, physically active treatment and cardiovascular exertion, multidisciplinary therapists, and also a plan to continue your recovery outside of the clinic. This is crucial to your overall concussion recovery. You should ask them questions about whether or not they treat in these ways. Don't settle for subpar treatment. Now, we understand that sometimes available treatment in your area is limited. And in this case, just try to make the best choice for your given situation. In the description below, there is a link to one of our blog posts that contains a list of concussion providers we have compiled from across the country. This list, of course, should only be used for reference. You will need to do your own research to determine if any of these providers are the right fit for you. Now, if you weren't able to get an appointment with a concussion specialist within the first 72 hours, that's okay. You can still take advantage of this optimal recovery time. Here are some tips on how to treat your concussion symptoms at home before your treatment starts. The first tip is to actively rest. Now, let me explain what that means. So formally, doctors have told their patients to go home, sleep, and don't do anything that requires thought or exertion or light or work or other activities. This is an outdated method that is proven to be ineffective. Actively resting, on the other hand, means that you allow yourself to do activities, but you don't overexert yourself, exacerbating your concussion symptoms. Your brain needs to work while it heals, so it's good to push yourself a little, but don't push yourself too hard as it may worsen your symptoms. Now, it's best to do this with a concussion specialist, but if you're waiting for treatment, you can do this at home with another person helping you. Doing this can help you start the recovery process. Things you can do to actively rest would be taking a leisurely walk with someone, doing puzzles, playing games, maybe even some card games, thoughtful meditation, or even reading a book at your own pace. Make sure that there is someone around to help you and keep you safe. The second tip is to practice mindfulness. There have been multiple studies that show that mindfulness actually helps in the change and recovery of the brain. Mindfulness is taking time to yourself to reflect on what is happening in the moment. You just think about what is happening to you here and now. And there are many free apps, YouTube videos, and podcasts that can guide you through mindfulness meditations. Now, please note, this is not sleeping or napping. Now, you can sit or lay down, but your mind should be active and mindful. The third tip is to manage what you're eating. There are many foods and supplements that can affect your brain's health during recovery. By avoiding foods high with caffeine, sugar, inflammatories, and stimulants, you can help your brain to recover correctly. Now, this also includes any recreational drugs. Do not stop taking prescription medications without talking to your doctor first. By managing your food intake, you can manage how your body will heal. By following these tips and scheduling an appointment with a specialist near you, you can prepare yourself for the best concussion recovery. If you have already gone through treatment and you are still dealing with concussion symptoms, then it's possible you are dealing with something that we call post-concussion syndromes or post-concussion symptoms. This is a condition in which your brain has not properly healed and still needs to be treated. Most concussion specialists do not have the resources, the understanding, or even the time or technology to treat it. Luckily, that's why we're here. At our clinic, Cognitive Effects, we treat patients that have been dealing with these symptoms for 3 months, 10 years, decades or more. We do specialized brain scans called fMRI or functional MRIs that can see and target areas in your brain that were affected from your concussion. Concurrently, we will also do structural MRIs of your brain and a structural MRI of your cervical spine, as we typically see those types of injuries with these long-standing concussions as well. We also have a large staff of therapists that are multidisciplinary so that they can use your scan to personalize your treatment. And we have over a decade of peer-reviewed research that shows conclusive results of recovery, something that is very unique to our clinic. If you think that you have post-concussion syndrome, we offer free online consultations. Click on the link above to sign up for your free consultation. Like this video and subscribe to our channel if you find this information helpful. For more information, please click on the link in the description below.